Dr. Judith Zackson is a clinical psychologist. She is based in Greenwich, Connecticut. The very first area I want to talk about in discussion with you, Dr. Zackson, is the area of what is referred to as work addiction. Some people who are listening to this discussion will identify with that. Others are going to think, wait a minute, this is just a whole lot of nonsense.
Sure.
What do you say work addiction actually consists of?
It actually ties in with anxiety. Workaholics is when your life is out of balance, and it could be detrimental because people who are workaholics, they don't take care of their health. They don't spend time with their loved ones. They and there's many reasons as to why people work, but when it's an addiction and your life is out of balance, it destroys your life just like any other addiction.
So how can you suggest that those who fall in this category of being workaholics, and at times I've been accused of being one, what can we do to control ourselves?
I think it's also important to look at the difference between being a workaholic and working because you need to make ends meet. But then the people that are not workaholics then make up for it with their wife and children. Then they'll, come home extra early or take an extra break and be with their kids and enjoy it and still go see a doctor and still go exercise. But a workaholic can't do those things. They're always working, whether it's Sunday. And when they're home, they can't enjoy it. So what could you do about it? First is knowing why you're working, to see what it is that's driving you. And the second thing is concrete limit setting. Just try to put away your iPhone and your iPad at a certain hour. But then a lot of anxiety will overcome a workaholic because they'll think, oh, my God, what am I missing? Or I'm having a hard time just being. And what I tell my patients is, think about it like you go to the beach, like an ocean, and a wave comes, and the wave just passes. It comes over you, and it passes. Similarly with anxiety, it's going to come over you, and then it's going to pass. And knowing that it's going to pass and that it won't kill you, and try to find evidence that it's a distorted thought, and try to almost talk yourself out of it. Because we have a lot of power over our thoughts. So I teach that to patients. And then a big thing to know is that it's not linear. Just like when you try to do anything, you're going to have success, but you also have failures. And to know that that's part of the process. You don't change your pattern from one day to the next. We have habits ingrained in you for many years, so you can't just change it.
Exactly.
These things, right? So these things take time, and be good to yourself. Don't bully yourself. Don't put yourself down and say, I'm never going to change it. Why even bother? Knowing that it's baby steps and being kind and saying it's okay. It's okay if I messed up today, but tomorrow I'll make up for it. And just, being kind and being good to yourself is a very big thing.